Hello, my name is Dr. Jeremy Richards, and I'm the course director for the Training to Teachers, or T2T program from Harvard Medical School. I'm a pulmonary and critical care physician, but I spend most of my time involved in medical education activities with students, interns, residents, and fellows at Harvard Medical School and at Beth Israel Deaconess Medical Center, one of the Harvard-affiliated hospitals. I'm excited to talk to you today about the T2T program, going through the content, organization, assessment, and opportunities of this innovative program for medical educators. The Egyptian Training to Teachers, or T2T program, is a blended learning program taught by experienced teaching faculty from Harvard Medical School. We really emphasize contemporary, evidence-based, modern learning and teaching approaches during the workshops and the between workshop content. The primary goal of this program is to develop highly skilled clinical educators who can apply theory and best practices when teaching medical students or more advanced learners. We also emphasize leadership skills in training leaders in medical education during this innovative program. Why would you want to participate in the T2T program? Well, first, we help you develop practical, modern, and evidence-based teaching skills to use with your learners in a practical, clinical, or classroom-based setting. We want to increase your familiarity with educational theory. Understanding the theoretical underpinnings of medical education is critical to be able to apply your skills in the most actionable and intentional manner. During the T2T program, you get to work with Harvard Medical School faculty who are experts in medical education and who will work with you to help you develop your medical education skills and your understanding of the theory underlying medical education principles. During the T2T program, you can develop a local and a global network of medical educators. These are people in your community, in your country, and across the world with whom you can work, who you can do research with, and who you can learn and grow from together. Finally, we do emphasize the importance of medical education research during the T2T program. We want you to become more familiar with the basics of medical education research so that you can assess research studies as well as apply those principles to your own research projects. As I said previously, a key component or a key goal of the T2T program is to develop medical education leaders. We want you, and we're going to help you to develop your medical education skills, your understanding of theory, and your medical education research abilities. We also want to help you develop your leadership skills so that you can be a leader in medical education across the country and across the world. Medical education leaders create new educational interventions. You will get practice with that during the T2T program. Medical education leaders implement new teaching methods in different settings with different learners using the skills that they've developed in this course. Medical education leaders can incorporate and change teaching practices at their own institutions and with their own learners. We emphasize the importance of that during the Training to Teachers, or T2T, workshops and course. Medical education leaders can improve the teaching of those around them. We'll talk about that and highlight strategies to actualize improvement of the teaching of those around you to help you develop your medical education leadership skills. Finally, medical education leaders are innovative and creative with educational strategies and interventions. Our goal in this course is to improve your teaching skills, take your teaching to the next level, as well as help you develop your medical education leadership skills. When you participate in the T2T course, the Training to Teachers course, you get to work with faculty from the variety of Harvard's teaching hospitals. That includes Beth Israel Deaconess Medical Center, where I'm primarily located, Massachusetts General Hospital, the Brigham and Women's Hospital, Cambridge Health Alliance, as well as Mount Auburn Hospital. Faculty from these different institutions will work with you in the workshops and between workshops through online hybrid-based distance learning to help optimize your teaching skills, increase your familiarity with theory, and augment your medical education research knowledge and abilities. The T2T model includes in-person workshops, online learning, and team-based learning. The in-person workshops really focus on application of topics and concepts. We take what we've learned from the online learning resources we provide that includes pre-learning of core topics and concepts in anticipation of the workshops. So when you come to the workshops, you're able to apply what you've learned in a hands-on, small group manner. There are large group sessions in the workshops where we have the whole cohort of learners together, but we try to prioritize breakout sessions, small group sessions, to really apply the topics and skills that you've learned. Team-based learning includes completing assignments and putting together presentations for your peers. We believe that building that network of local collaborators through the workshop participants is a core component of the T2T experience, and we emphasize that based on team assignments and presentations. The program overview for the T2T program for Egypt includes online recorded lectures that you'll view in advance and that are supplemented by quizzes or knowledge assessment tests to ensure that everybody is getting what they need to out of the online recorded lectures. After viewing a series of online recorded lectures, Workshop 1 will occur. Workshop 1 will take place over several days, typically 4 days, during which we'll apply the concepts that you learned about and were exposed to from the online recorded lectures. After Workshop 2, there's another series of online recorded lectures and webinars that lead up to Workshop 2. There are quizzes, again, knowledge assessment tests to ensure that everybody is learning what they need to from the online recorded lectures, and so that there's minimum level of understanding prior to Workshop 2. Workshop 2 leads to more online recorded lectures, which are supplemented by more quizzes, and lead to Workshop 3. Workshop 3 is attended by a select number of participants from Workshops 1 and 2. Prior to Workshop 2, participants are asked to complete what's referred to as a Capstone Project. This is a cumulative, summative demonstration of participants' understanding of core course concepts and topics. I'll discuss more about the Capstone Project shortly. In addition, all participants have both team-based assignments, which I referred to already, as well as individual assignments they must complete prior to Workshop 2. I'll provide more details about all of those in the upcoming slides. This map or overview encapsulates the T2T program and the order of events within that program. Online recorded lectures lead to Workshop 1, which lead to more lectures, which lead to Workshop 2. A select group of participants will have more online recorded lectures and go into Workshop 3. Quizzes, the Capstone Project, and individual and team-based assignments provide the assessment and the opportunity to apply the knowledge that you learn from the online lectures and workshops in an intentional and meaningful manner. There's a lot of content that we cover in the T2T program. Briefly reviewing the core curriculum topics, you can see that we emphasize curriculum design and implementation, principles of adult learning. I've said many times that we emphasize applying educational theory to teaching practices, and that we prioritize evidence-based classroom and clinical teaching methods. Active teaching strategies are a core component of the T2T program, and we'll talk through a variety of different active teaching strategies that you'll be exposed to and have opportunity to practice in the T2T curriculum. Evaluation, assessment, and feedback is a core pillar of the T2T program, as is technology-enhanced teaching, effective strategies for clinical teaching, and, again, medical education research. In terms of workshop themes, Workshop 1 includes many different facets of medical education, but we emphasize both curriculum design and active teaching techniques. Other components of medical education are certainly covered in Workshop 1, but these are the two major themes that I want to emphasize for you, a potentially interested participant in the T2T program. Workshop 2 includes active teaching strategies, again, emphasizing and building on what was reviewed and practiced in Workshop 1, as well as assessment, evaluation, and feedback. Again, the other curricular themes that were presented on the prior slide certainly come through in Workshop 1 and 2, but these four aspects, curriculum design, active teaching, more active teaching, and assessment, evaluation, and feedback, are pillars of the workshop that are strongly emphasized throughout the two different in-person, face-to-face sessions. The student experience in the T2T program is multifaceted, engaging, and challenging. We want you to be able to learn and apply high-level knowledge about medical education so that you can optimize your classroom and clinical-based teaching. In terms of resources, there's 24/7 availability of on-demand video materials. We have webinars between workshop 1 and 2 to emphasize key take-home points and maintain connection with course participants and course faculty. There is ample networking at the workshops between both participants as well as faculty. All participants have complimentary access to the Countway Library, which is the premier library of Harvard Medical School. The time commitment varies, but we estimate on average students will spend somewhere between 7 to 10 hours per week. Some weeks there may be less time commitment, other weeks there may be substantially more time commitment, such that the overall average is around 7 to 10 hours per week during the T2T curriculum. At completion of the T2T curriculum, participants who have successfully passed all of the assessments and participated actively in the workshops will get a certificate of completion from Harvard Medical School. You are also eligible for an associate alumni status at Harvard University. I should emphasize that this does not include a Harvard email address. The online quizzes and modules that you'll see here before workshop 1 include the principles of adult learning with various subsegments, the application of adult learning theory to teaching, teaching methods, and then optimal teaching skills for teaching on the wards and clinics. The content within these online modules and quizzes will be re-emphasized and built upon in workshop 1. Between workshop 1 and 2, there's another series of online videos for participants to review. And between workshop 2 and 3, there's another series. I'm only showing you the videos before workshop 1 to emphasize the general nature of the content prior to workshop 1. It's similar between workshops 1 and 2 with an emphasis on active teaching as well as assessment, evaluation, and feedback. The individual training assignment that I referenced earlier that occurs between workshop 1 and 2 involves you, the participant, recording a 5-minute video of yourself teaching. You can use your phone. It does not have to be high tech. We basically want to see your teaching skills. You can teach in any setting on any topic, but we ask that you use the educational techniques that were covered in workshop 1 in your teaching video. You'll upload your video to our learning management system, which is called Canvas, and it will be viewed by both course faculty as well as other course participants. We specifically want each course participant to view and evaluate videos from 5 other participants. So this exercise involves creating a teaching video, but also reviewing the teaching videos from your colleagues within the T2T cohort. We think this has value because it obligates you to practice teaching and apply teaching skills learned in workshop 1, and then also view, evaluate, and reflect on videos from other course participants, increasing awareness of and exposure to different teaching techniques. We ask the participants complete a final course essay written in English describing how the participant plans to use or has started to use a teaching method or skill from workshop 1. In addition, we want to hear how the participants are incorporating either educational theory and or medical education research evidence into your teaching. Finally, the essay should include challenges that you have faced in using new teaching methods and how you have overcome them in your teaching in the context of the course. I've referenced the Capstone Project before, and this is a summative, cumulative, important component of the T2T curriculum. We want participants to first submit a description for developing and or implementing a proposal for an educational project. The educational project can be a new curriculum, course, teaching session, intervention, or innovation in the current teaching processes or practices at your institution. You need to include a letter of endorsement from your supervisor or director to ensure that there's institutional awareness of your project. This is important because we want your project to be, if possible, implemented, and making sure that your institution's leadership are aware of and in support of your project is a key step in ensuring that implementation can occur if possible. Your capstone project will be assessed based on the innovation of your project, how feasible it's perceived to be, and on your presentation of the project's content and organization. The Capstone Project is a big part of our course and a big part of our evaluation, and it really allows you to manifest your understanding of the topics that we discuss in the course and apply them to working through or developing an educational project that has meaning for you, your learners, and your overall clinical and educational community. The course faculty will provide commentary and suggestions about your initial idea for the Capstone Project. But after that initial commentary, you have to draft independently a first draft of your capstone proposal. Your capstone project proposal will then be reviewed and feedback will be provided on 2 separate occasions as you continue to develop it by Harvard Medical School faculty. Ultimately, when you submit your final capstone project proposal, it will be reviewed by a faculty panel at Harvard Medical School. Again, we take the Capstone Project seriously, and it's a real opportunity to apply many of the course concepts and topics in a way that can meaningfully affect teaching at your institution. Briefly, I'll pass along the assessment details of the course, the online quizzes and modules. You have to get above 70% or at or above 70% to pass them. For the individual assignment, that's the teaching video, we set a relatively low bar. You have to have a 3 out of 9 on the assessment rubric that we use for this video-based intervention. We really prioritize your participation in this project rather than necessarily achieving high grades, as this is more of a practice assignment. The final course essay, you have to achieve at or above 70%, 3.5 out of a 5-point scale. And for the Capstone Project, you have to get greater than 4 to 5 or 80% on the assessment rubric. Again, for the Capstone Project, you're assessed on feasibility, innovation, and the overall presentation. The total percent of the grade for the online quizzes is very low, 10%. The individual assignment is 10% as well, and that's actually included in the overall participation grade. The final course essay is 30%, and the Capstone Project is 50%. As you can see, the Capstone Project is a big deal. We emphasize this during the course and want you to really put in effort to create a meaningful project that's feasible, innovative, well presented, and that can be implemented at your institution. The final cumulative grade of the course, you must have greater than 70% to graduate. To graduate with distinction, you must have a final cumulative grade of greater than 90%. We want you to succeed, and the course faculty for the T2T curriculum will be with you on the journey that you're about to undertake in the Training to Teacher cohort. On completion of the course with a grade, overall cumulative grade of greater than 70%, you'll be presented a certificate of completion from Harvard Medical School. Again, you have to complete all of the academic requirements and meet all of the attendance requirements to receive the certificate. The certificate will note honors achieved in the overall course and the Capstone Project, commenting as appropriate, as indicated, on distinction and or commendation. So who should apply to the Training to Teachers program? We recommend medical educators and clinicians. People who work with other learners, students, interns, residents, fellows are more than welcome to apply. Candidates with an MD, PhD, MBBS, DMD, DDS, PharmD, DNP, or other equivalent degrees are eligible to apply. If you don't have one of these degrees or an equivalent, we'll consider your application on a case-by-case basis, and approval will be made at the discretion of the course director, that's me, and or the course faculty. The final selection of candidates or of applicants will be made by the Harvard Medical School faculty, and it includes a review of application materials, including the candidate's curriculum vitae or CV, a letter of recommendation, as well as a potential pre-acceptance interview on a case-by-case basis. If you have questions about the application process or the selection process for participants, please reach out and we can endeavor to answer any questions that may arise. In terms of the application process, why you would want to apply, again, this is a certificate program that's really focusing on medical education theory and practice. These are things that can be really helpful for you as you want to augment your teaching skills and become a medical education leader. You'll develop skills and knowledge in medical education, including, but not limited to, adult learning theory, curriculum design and implementation, active teaching strategies, assessment, evaluation, and feedback. As part of the T2T cohort, you're going to get to interact with and learn from world-class faculty from Harvard Medical School and its affiliated hospitals. Finally, as I've emphasized throughout, there's opportunities for local and international networking to really grow your community of medical educators and grow your opportunities to engage in projects, innovate and create new curricula, and teach at a higher level. Thank you so much for your time and attention. Shukran. We look forward to working with many, if not all of you, in future T2T programs. If you have any questions about any content of this video, please don't hesitate to contact me. This is Jeremy Richards, the course director for the Egyptian T2T program.